I'm Cindy, and I'm with LifeTrack Resources, and of course, you're singing my song because what we do is early childhood and family services for families and child protection. And so my question is, I know the research, I know the brain research, I know the child protection research. We all know what works. We all know the child protection system is broken. We all know the state is not funding it. What can we do to get county and state to pour more resources into it so we can serve more of these families who aren't even making the bar and who have just as many needs as those who get into the system? How can we impact the policymakers? Anybody?
I'm going to take a stab at this. Hello, Cindy from LifeTrack. What I was going to mention was the type of analysis that the Federal Reserve we've been able to do in terms of articulating the economic return it's a powerful message to those who are looking at county budgets and being able to understand that if they do put money in up front, that they do save a lot of money going down. So I'll be interested to hear, maybe I'll pose a question to David, what your early response is to your study in terms of funders. Are you sensing that showing that alternative services versus a typical child protection approach has influenced funders to maybe put some more dollars up front in prevention?
So the program I talked to you about, Alternative Response, it's called Family Assessment Response, had research connected to it, and here's the final report on that. And Senator Becky Laurie, who was the person who was going to be on this panel, was the primary sponsor of legislation that institutionalized the differentiated approach to child protection in the statutes, so that now every county in Minnesota has the ability to differentiate their response, one focused on services, and then for those very high-risk cases, very aggressive investigation. 70% of all reports in Minnesota now get a family assessment. When Senator Laurie was talking to the committee that was going to approve this or not, she held up this report and said, you have to read this. That piece of legislation passed with no dissent in the Senate. So one of the things I think we need to do is the kind of research that was done by the Federal Reserve, the kind that I know Cindy does at LifeTrack and other places. We have to prove that because there's a cynicism about the use of public dollars. There's a cynicism about redistribution of wealth. And we need to, I think, be politically active as well as smart about this, because individuals who are not swayed by the public good argument may be swayed by the economic argument for that. And I think we have to research, be advocates, and use that and move forward with that.
I just want to follow up my own follow-up. And that is an example from the state of Texas. The state of Texas began looking at how they approach their entire criminal justice system and where they could make savings in some of their sentencing laws so that they could use those savings and invest them in upfront in prevention in the Nurse Family Partnership Program, which provides it's a public health model, but it is a whole family-based model where a registered nurse goes into the home of a pregnant mother who's having her first child and is poor, but stays with that mother and the family until that child is 2. And results of the studies on that program show that it can have an impact on crime and juvenile activity later on in that child's life.